Okay, a couple of basics that I need you guys to know when you're doing medications. I want you to understand the purpose for a lot of these things. For example, if someone has a PRN stool softener, okay, this is something that you guys should just give daily. You know, this is not a laxative, okay? So some people will say that these work like laxatives, but they don't, okay? These just soften the stool so it's not uncomfortable when they have a bowel movement. It may have a slight, because, you know, it does say it can relieve constipation. So it may have a slight bit of laxative, but this is very, very mild if it does. So I would suggest just giving these every day if they have it as a PRN to make your lives easier. Because obviously the more backed up they get, the higher the chances that somebody is going to have to clean up a big mess. The other thing that I want to make sure you guys know about, let me see here. Okay. All right. So for those of you who don't know, probiotics are amazing. They're a natural, it's like a good bacteria that gets in the stomach that we all have. But when you take a lot of medications and you're elderly, a lot of times you don't have the good bacteria. It's really low or you don't have it at all. And so the bad bacterias can really overwhelm the system and cause a lot of problems. So having the residents take these is really good. I actually pay for all of these. Well, I don't, not Darlene's, and not Bonnie's anymore. But, you know, if a family doesn't seem too big on the idea of the probiotic, then I will pay for them. That's how important they are to me. So it's really important you guys are giving it every single morning or whenever it's ordered for. But mornings is the best on an empty stomach. So having them take it with food, it's not going to be as effective. So that's why I try to have you guys give medications before breakfast, unless the resident, you know, has a preference for taking it with the food. But anyways, so make sure everybody's getting their probiotic. The other thing that this is effective against is UTIs. So if you don't want to have to be doing urine samples and stuff like that and sending those to the lab, which we haven't had to do for a long time, it's because of these. So make sure the residents are getting that. I know it's easy when you're dealing with these rolls. Sometimes people forget about the ones that you got to pull out the bottle. So if you're looking at the Mars, which you should be doing when you set up meds, so that way you can make sure you're not missing any medication, then you will, you know, obviously not have that issue. The other thing is the cranberry. Okay, now that is effective in preventing a UTI. It's not going to get rid of one if they already have it, but if they are clear, then this will keep them from getting another one. And it just does that by keeping it makes the bacteria unable to grab on or latch on to the bladder. So this is really, really beneficial. Now, these two together means you will never have a UTI with your patient, okay? So we don't like it when the nurses try to DC one of these. Because they're not the ones who got to deal with it if the resident gets a UTI. We are. So we don't want them to DC those. Anyways, so make sure that they get that. The other one that's really important, which you guys may not know, just depending on your background and experience, is aspirin. Aspirin is a blood thinner, and for residents that have a history of blood clots, it's really important that they have their aspirin. So do not miss those. Do not forget those. Those are really important. And then of course, you know, their laxatives. I try to stick to the more natural, like prune juice and stuff. And just trying to make sure that we do a really good diet, but sometimes that doesn't even help because they take medications that really cause constipation, like narcotics. So, you know, you just want to make sure that you're giving them every tool you can to assist them. you know, if we have it, let's use it. Okay, and that's the same thing with like the Tylenol and the mild pain relievers. If you're dealing with residents who are really irritable or snappy or moody, a lot of times with dementia, they cannot tell you that they're in pain or they're uncomfortable. So when you see irritability, just assume it's from pain, okay? Just assume, because if it's not, a Tylenol is not going to hurt them. But if it is, it's going to make their life and your life 1,000 times better. So if it's in our arsenal, then use it. It will really, really help you guys. Same thing with, you know, the creams, the barrier creams, the powders that, you know, we use sometimes for like, whatchamacallit, can't think of the name, but the little bacterial skin issues and stuff like that that make them uncomfortable, or that will cause pressure ulcers and things like that. Use it, and use it liberally, so that we can avoid those things from happening. Preventing these things makes your life way easier, because once they have these issues, then we got to not only keep it from getting worse, but we need to make it better. We need to get rid of it, and that's a lot of work. So preventing is always the best scenario. So anyways, let me know if you guys have questions about any of that. And also make sure that when you guys are doing NARC counts, that you're making sure the comfort kits are there and they're undisturbed, meaning that they are still sealed. Just for your own protection. Make sure that that's happening. Okay? All right. Thanks. Bye.